Good. Start.
Good morning, everyone. I am presenting a comparative study between electrocautery and conjunctivoplasty for the management of conjunctivocalysis. As we know, there's a proper functioning tear film is crucial for the ocular surface as it provides comfort and protects from environmental factors, and it smoothens the ocular surface for clear vision. So we have conjunctivocalysis, which is a chronic condition of the conjunctiva, which causes non-edematous conjunctival folds in inferior bulbar conjunctiva, both the eyes. It is one of the most frequent cause for ocular surface irritation and discomfort in the elderly population. For management of conjunctivocalysis, in surgical management, we have conjunctival excisional surgery and electrocautery. In radiofrequency, electrocautery is a minimal invasive procedure which is painless and very quick lasting procedure, lasts on 1 minute on average. There is a novel technique of conjunctivoplasty with fornical conjunctival suturing, which induces conjunctival adherence to the fornix and reduces the conjunctival folds. So the aim of this study was to compare electrocautery and conjunctivoplasty for the management of conjunctivocalysis, and one of the objectives was to evaluate the tear film meniscus using AIOCT before and after the procedure. It was a prospective interventional study done in a tertiary eye care center in South India with a sample size of 50 patients, 25 patients in both the groups. These are my inclusion and exclusion criteria. So consent was taken from all the patient, and for pre-operative and post-operative assessment, we did tear film breakup time and Schirmer's test, and with the help of Cirrus HTOCT 5000, we calculated tear film height, tear meniscus area, and cross-sectional area of conjunctivocalysis. This is the anterior segment ASOCT for conjunctivocalysis and normal tear meniscus showing. So for the procedure, for both the procedures, we did local infiltration of the conjunctiva with 2% lignocaine. For fornical conjunctival suturing, we did loose conjunctiva was draped into the fornix, and with the help of 60 Weichel suture, the conjunctiva was exteriorized at the corresponding area of the conjunctivocalysis. It can be taken laterally, centrally, and medially. For post-operative treatment, antibiotic and low-dose steroid, and if needed, oral analgesics were given. This is the procedure showing with the help of 60 Weichel suture. The conjunctiva near the fornix is exteriorized and suture knots were tying according to the conjunctivocalysis area. Then for electrocautery procedure, we did the area of the loose conjunctiva was retracted with the limbs forceps from the perilumbal area, 4 to 5 mm from the limbus, and RF cautery in fulguration mode with the power of 1 millijoule was applied in 2 rows of burn. 1 to 2 seconds of cautery was enough to cause the blanching of conjunctiva, and the same post-operative treatment was suggested. These are the pre and post-op pictures of fornical conjunctival suturing and electrocautery. For the results, both the procedures showed a male preponderance, and mostly patients had grade 2 conjunctivocalysis according to Lipgoff grading. For results, the Schirmer's test did not show any significant difference between post-op periods, and there was no difference between both the groups. Also, tear film breakup time suggested significant post-op improvement, but the procedure difference between both procedures were not noted. As the same in tear film height also showed a significant improvement in both the procedure, but with the electrocautery group, it showed a statistically significant increase in tear film height in electrocautery group than fornix group. Tear film meniscus area also showed significant improvement in both the groups, but the results were comparable. Conjunctivocalysis area showed highly significant decrease in with both the procedures. And for discussion part, G et al. Conducted a study where patients who underwent high radiofrequency electrocautery for conjunctivocalysis correction showed a significant increase in tear film breakup time post-operatively. Similar to our study, Hara et al. Also found no significant change in Schirmer's tear test after surgery for calysis, indicating that maybe aqueous deficiency was not the primary cause of the symptom. Su et al. Demonstrated a significant improvement in tear film breakup time following high wave radiofrequency electrosurgery. In Kaglen et al. Reported a significant increase in tear film height after electrocautery and significant decrease in conjunctivocalysis, similar to our study. The conclusion, both the procedures are having similar effect on tear film characteristic, improving the tear film characteristic, and can be chosen upon the as the surgeon's preference. The conjunctival in initial period, the radiofrequency electrocautery showed better results and greater comfort to the patient. The main limitation of this study was functional questionnaire was not added, like ocular surface disease index, and longer term studies and larger sample size is necessary to see the long term outcome of both procedures. These are my references. Thank you.
Any particular reason for the male preponderance?
Ma'am, it was also done in rural and suburban population in Tamil Nadu. So mostly
More exposure to UV.
yes, ma'am. According to
Which procedure was less time consuming?
ma'am, electrocautery was comparatively very faster, ma'am, because we just need to apply small burns, and that also for 1 seconds. So it very mild blanching we needed. So it was very fast, ma'am.
So your post-op results are almost comparable at all levels.
Yes, ma'am.
So-
When we did post-operative period, tear film height was comparatively increased.
Otherwise, everything was comparable.
Yes, ma'am. Callosis area was decreased very nicely in both the procedures, ma'am.